With us here on the Tuesday edition of the South African Morning. It's an alarming number of children who are just not getting the food they need. We're talking about nutritional food here. It could, of course, stunt their growth. The State of Nutrition report in South Africa says most of the country's children are simply lacking basic good nutrition. Let's discuss this with the Tiger Brands nutritionist, Arthur Ramoroka, joining us from Johannesburg this morning. Hello to you, Arthur. Here's the problem. Eating healthy is rather expensive, and children think it's quite yucky. Arthur, you with me? You can hear me? All right, Arthur, let me try one more time. I had you a moment ago. Arthur, speak to me about the reason that children aren't getting the right kind of nutrition. I imagine it's because the cost of healthy food is still very high.
Good morning, Gareth. Indeed. We are releasing the State of Nutrition report in South Africa today by the Eat Well Live Well Institute. And we did a deep dive around understanding children's needs around nutrition and really nutrition behavior. And we found that 38% of parents believe that their children do not have access to healthy foods and also an understanding thereof. And there are many factors really that contribute to that, because when we did a deep dive as well, we found that South Africans rated cost, taste and promotion of food items as some of the factors that they actually consider when they're purchasing their food, which really shows us that nutrition is often sacrificed in the moment, despite some consumers even knowing better around the health and nutrition benefits of certain products they actually can purchase.
Yeah, it's also not just about the purchasing power and the cost of this, Arthur. You're absolutely right as well. The problem, though, and I know you missed this part of my first question, was nutritious food is not very yummy. The kids don't like it. It's rather yucky. That's the problem with healthy food, isn't it?
Yeah, and I think what we have also done in this year's report is around guiding, parents and guardians or caregivers around how can we make, nutritious food for children that they will actually enjoy. And this is an interactive report that we are launching today with different tips. We have, guidance and contributions from different nutrition professionals and within the space of health and nutrition that are really providing those insights around how can you make simple and easier, delicious, nutritious meals for the kiddies so that they can enjoy, so that we're able to foster healthy eating environments and behaviors for children, because that is really a critical window. Formative years are really great so that we're able to influence children so that they can grow into healthy adults.
Here's the problem as well, though. While we talk about these tips, and I'm sure they're all very, very good tips, Arthur, I'm sure you'll agree with me when I say that it's all good and well to take a bit more precaution, take some care, and find more nutritious food. But for many, many people in this country, they simply can't afford to do that. They are living at the breadline or just below. So they can only afford what they can afford, and they can't even buy very much of that. And that's the reality I'm sure that you can speak to as well.
Yeah, we have seen that, food nutrition and also food security is something that is really still a challenge in the country, where for a lot of people, priority would be to, just a tummy fill. And often it means that they're going to actually then get those food products that may not necessarily provide them with nutrients, but also just a calorie density. But we know that there has been many activities and initiatives that have been brought by the industry in terms of making food or healthy food really affordable for most South Africans, but also tapping into what people don't know, because we have, those sort of food products or food groups that people don't necessarily have more of, like legumes or pulses, which are really nutritious. And we have seen that over the years, they've actually not been making it to the plate. And those are really things that we have at our disposal, which are actually really affordable and can become part of a healthy diet if we really bring them back into our diet, and also making sure that we increase our intake of vegetables, which we know we often have access to in most communities in South Africa.
Last 30 seconds I have with you, Arthur, as well. The problem is this: healthy food is not very well marketed, is it? It's not very well advertised on radio and TV, but good heavens, can you find yourself a quick burger on the way home? So how do we try and change the optics of healthy eating? I've got 30 seconds left with you.
Yeah, I think we need to leverage our marketing efforts, you're right, in terms of making healthier food more accessible to people and also just communicating the real benefits those products contain so that, healthy eating can become easier and become something that people can internalize in their daily lives.